Support comes from the Missouri Forest Products Association. Missouri produces wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details on the variety of products made in the state are at choosewood.com.
From St. Louis Public Radio. This is St. Louis on the Air.
I do want to strongly say that there's not a nursing shortage. There's nurses that are willing to work and they're willing to do the job. They're just not willing to do it in the instances that are current.
There is no real shortage in nursing. It really and truly is not. What we're looking at is nursing running away from the environment, the atmosphere.
Or the day before, we didn't have EKG people. And so now I'm the EKG technician, and management is just throwing on more and more and more.
Nurses know that it's hard work. Nurses are not running away from hard work. That's not the issue. The issue is the unnecessary stress.
I'm Rod Milan. Burnout of nurses has become a very real issue, and hospital management has not done enough to address it. Joining me in studio to talk about this are Sarah DeWilde, and she is currently a registered nurse at SSM Health at St. Louis University Hospital, and Rita Reed, a recently retired nurse at SSM Health St. Louis University Hospital. Sarah and Rita, thank you very much, and welcome to St. Louis on the Air.
Thank you.
Thank you.
First, can you talk about the staffing shortages that are going on, not just around the country, but particularly at St. Louis University Hospital?
Sure. Currently so I'm a nurse at SLU Hospital, like you said, and been there for pre-pandemic and, of course, post-pandemic. So a lot of our difficulties are the widespread nurses are just not wanting to be at the bedside anymore. When COVID happened, we noticed a lot of people coming out of retirement, coming off of, staying at home or things like that, to come, join the call of duty of helping the fellow civilians. And a lot of them, came out of the woodwork to help, and we had staffing ratios that were amazing. A lot of us were, in the ICU, which is where I am, 2-to-1 ratio, sometimes 1-to-1, which is really great whenever you have a really, really sick person, right? So on the floor, it was 5-to-1, which is usually a really good day. Now we are noticing that nurses are leaving the bedside, not only to go travel and make more money or live their lifestyles in the gypsy world is what we like to call it, but also they're just tired of dealing with the staffing shortages, the supply shortages, things that we should have on everyday hand and everyday use. And when you can go work somewhere a lot less stressful, a lot less, damage control every single day, it's a lot more appealing than sticking at the bedside whenever you could potentially, catch a virus that we don't know about. And, a lot of people feel disrespected in the fact that they don't want to be lied to anymore and said that, oh, we don't have what you need. And they can go work someplace else and feel safe. A lot of nurses have left, and we're feeling it now. Tripling in the ICU is 6 patient assignments, which is totally hard to work at.
Well, you've mentioned how that's affecting it. You're saying that maybe 3 times the number of people. How else are the vacancies being felt by on a given shift that you might have, depending you're in the ICU and maybe some other people in different areas of the hospital as well?
Yeah, we notice it a lot in the emergency rooms right now. The ER nurses are the ones that are dealing with the hardest part. You're the sickest at that point. You're coming in from home that you just, you're starting at square one, where I'm in the ICU. It's a little bit nicer in the fact that you can kind of already know what's going on. But in the ERs, they're having a lot of trouble keeping nurses because it is that high intensity level and people get burned out really fast. The biggest thing that we've noticed lately is nurses are working overtime just like they did in the pandemic, and you can only do that for so long. 3 shifts a week is 12-hour shifts are hard, but you're talking 4, 5, 6 shifts a week and back-to-back weeks. You can only do that for so long, and we were doing that a lot in the COVID days. And so we were hoping that things would slow down afterwards, and they just haven't.
Well, what about the traveling nurses, and what does it feel like for you while you're there working? Since you're a permanent nurse at the hospital, what is it like seeing people who might be better compensated for coming in and working alongside of you while you're working all of these extra shifts?
Yes. This is difficult because I love my travel nurses. I used to be one. I wanted to travel the world and see what was going on. But coming back, being a permanent staff member, knowing that you are working the same exact job, doing the same exact duties as your next door neighbor, and they're making sometimes twice, sometimes 3 times more money than you doing the same exact thing. It's, it really gets you, because I'm so thankful that they're there, because if they're not there, my job would be harder and I'd have to take more patients. But it is really hard, and it does decrease morale and wanting to stay at the bedside knowing you're not making nearly what you could be doing the same exact job.
And Sarah, that's definitely your opinion, but Rita, you just retired last month after being around for 46 years with SSM Health. Can you speak to that issue as well, and what made you retire in the first place?
I'll speak to the issue of travel nurses coming in and making more money. I think what that speaks to, it clearly says the facility does have the money. They have the money. They can pay their regular nurses, not travel nurses, but their regular nurses, more money. They can do that. The budget allows for travel nurses. If they flip that and they pay more money to the nurses, because, see, nursing is a field where it's hard work. Nurses know that it's hard work. Nurses are not running away from hard work. That's not the issue. The issue is the unnecessary stress that's placed on nurses. You come in, and what's supposed to be an acceptable assignment is not. You come in, and let's say, for example, you should have only 4 patients on an acute behavioral health unit. You come in and you got 5 or 6 of them on a very acute psych unit. That poses a major safety problem right there in and of itself. Just the fact that you have the 6 patients. But the type of patients you have, okay, now impacts it even more.
Now, is that something that played a part in you taking earlier retirement than maybe you thought, or not? What actually caused you to leave the SSM system?
My retirement was not early, okay? I've been there 46 years.
Okay. I couldn't have told by the way you looked. So.
I was due the retirement, okay?
Okay.
But I think there was some level of frustration as I watched the younger nurses as they were trying to push forward and maneuver through a lot of what I call the dust. And that just means that so much is being thrown at them all at once. And they're supposed to manage all these things. You have your new nurses that come in, okay? And you have a nurse assigned to precept that new nurse. But guess what? The preceptor, which is the seasoned nurse, has an assignment. It's difficult to do a thorough job.
But how is that something that comes directly from management at your former hospital and your current hospital? And it's not just something that's affecting hospitals in general, because the COVID-19 virus is causing such a disruption in the industry as a whole.
See, when I speak, I am speaking globally, okay? This is not just a one hospital situation. This is global. You know, it's not just where I left. It's other facilities It's about the same. It's like, management has removed itself, for the lack of a better way of putting it, from what it really is like to be out there in the field, hands-on, working directly with patients. They've lost the concept, the reality of what is required to accomplish your 12-hour shift.
Sarah, are you feeling the same way as well?
Yeah, exactly the same way. And I just want to add, nursing in itself is not the same as what it was even just 5 years ago. Your patients are a lot sicker these days, especially with COVID-19 coming in. Now not only am I getting a motor vehicle crash, but he also has COVID. That wasn't a thing 2 years ago. So they're not only dealing with femur fractures and things like that. Now I'm dealing with a respiratory thing on top of it. So nursing has become more complex, more complicated. And the issues that we're having is management is asking us to do more. So I'm having to do audits on myself, or they're watching my charting has to be on point. I have to do every little thing as to every little detail. Plus, also, I'm the tech. I'm the lab drawer, because some days those aren't a thing. I think yesterday when I was at work, or the day before, we didn't have EKG people. And so now I'm the EKG technician, and management is just throwing on more and more and more and asking us to do more with less. So
this question both for Sarah and for Rita. Your colleagues at SSM Health at St. Louis University recently passed a no-confidence vote against the hospital's chief nursing officer, Rita Fowler, and the HR director, Chris Greenlee. And Greenlee, since that vote happened, has actually resigned, but Rita Fowler is still there. Mm-hmm. How did that vote end up passing?
That vote was pretty unanimous. We ended up doing, the typical now day and age kind of petition, which is, we did an online petition, but about, 80%, 90% of the vote was they were not confident in their CNO, and they didn't feel that she was doing a good job.
And Rita, were you around for that vote as well?
I wasn't.
And you weren't. And I want to make sure that because we did invite SSM Health St. Louis University Hospital on to the program, and they responded to us with this statement. SSM Health St. Louis University Hospital, like all other healthcare systems across the country, continues to face challenges due to the COVID-19 pandemic and the nation's critical shortage of nurses and healthcare professionals. Despite these challenges, we do our best to ensure quality patient care. The hospital has encouraged existing staff and contracted personnel to fill current vacancies while we engage in a robust effort to fill our open clinic staff positions. We provide competitive compensation to include a recent increase to our graduate nurse salary and adjustments for experienced RNs, opportunities for career development and growth, and programs to support employee physical, emotional, social, and spiritual well-being. We've asked National Nurses United to assist us with recruitment and retention efforts, and we are concerned that these erroneous claims are harming our ability to attract new nurses and other clinical staff. It is of utmost importance that an accurate depiction of our hospital and the life-saving care our team provide daily are top of mind in our community, rather than counterproductive claims that hinder our efforts. Now, you have a contract that's coming due next summer during 2023. How do you respond to that statement that has come out from SSM Health St. Louis University Hospital? Sarah?
Some pieces of that are very true. They have increased some of their competitive wages, but it's there. I'll respond that, yeah, okay. But also at the same time, we have been giving them over months and even years of recommendations. What would make nurses happy? What would make nurses want to stay? What would make and all of it is not only just compensation and things like that. We're talking just regular everyday equipment needs and things like that. Just being able to have a bed that works and I don't have to check and make sure that it's gonna go up and down when I push the buttons is a recommendation that would make my life a little bit easier. Having more techs at the bedside, having more sitters available whenever we have patients that are suicide and behavioral needs that are needed there. I do want to strongly say that there's not a nursing shortage. We knew that. We saw that in COVID. There's not a nursing shortage. There's nurses that are willing to work and they're willing to do the job. They're just not willing to do it in the instances that are current.
And Rita, before I get to you, just a bit of a clarification as well. We invited SSM Health St. Louis University Hospital to record a statement and to answer the question before today's show rather than do a live interview. Rita, how do you respond to that statement?
I think Sarah's right on point. There is no real shortage in nursing. It really and truly is not. What we're looking at is nursing running away from the environment, the atmosphere that they find themselves having to work in. As a professional nurse, when I went into this field, I'll be honest with you, what I see now does not reflect or resemble what nursing should be. And for an example, nursing back in the day, okay, and I say back in the day because it was, I worked a 60-bed unit, and there may have been 5 nurses scheduled to work that day. But you know what made the difference? I had 10 non-licensed staff members who did all of the direct patient care. They did the turning, they did the feeding, they did the ambulating of patients, they did the toileting. That takes a burden off of a registered nurse who's supposed to be doing all of the professional aspect of that patient's care. That is not part of the picture anymore. Nursing comes on duty, and you're expected to be the professional that you went to school to be. You're also expected to be the janitorial service if need be, because housekeeping was called off or whatever. You're also expected to be, just like Sarah said, the EKG technician. You're supposed to be the lab person that's drawing the blood. It's just all these different things.
And Sarah, very quickly, is that the same thing that you're seeing as well?
Absolutely, 100%.
Okay, well, I would like to thank both of you for coming on the air today. We've been speaking with Sarah DeWilde. She's currently a registered nurse at SSM Health St. Louis University Hospital. And we've also been speaking with Rita Reed. She is a recently retired nurse at SSM Health St. Louis University Hospital. Thank you to both of you for coming on today.
Absolutely,
You're
thank
welcome.
you.
This episode was produced by Emily Woodbury. Audio engineering and podcast design by Aaron Dorr. Our production intern is Avery Rogers. Alex Hoyer is our executive producer.
St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
Our podcast proudly supports St. Louis artists by using music from Life Creative Group. Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations. And leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thanks.
St. Louis Public Radio is a member-supported service of the University of Missouri St. Louis.
Support comes from the Missouri Forest Products Association. Missouri produces wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details on the variety of products made in the state are at choosewood.com.